So we were doing Sjogren syndrome. Sjogren syndrome is autoimmune destruction of exocrine glands. Exocrine glands such as lacrimal glands and salivary glands, they are destroyed due to an autoimmune reaction. So destruction of lacrimal glands will result in dry eyes, and uh, dry eyes will lead to keratoconjunctivitis sicca. And also destruction of salivary glands will result in dry oral cavity, and the person will complain of difficulty in swallowing. So someone with itchy eyes and dry eyes and a feeling of sandy sensation under their eyes, along with difficulty in swallowing and bilateral enlargement of parotid glands, you will suspect Sjogren syndrome. The investigations that can be done to confirm the diagnosis, the investigations that are related to dry eyes, they include Schimmer's test. Schimmer's test will show a decrease in production of tears. In this test, a litmus paper is placed in the eyes, and then tear production is measured. And the second test is Rose Bengal stain, which will show corneal ulceration that occurs due to dry eyes. Rheumatoid factor, this will be positive in nearly 100% of the patient, and the specific antibodies that are specific to Sjogren syndrome, they include anti-Rho and anti-La antibodies. SSA or SSB antibodies is their second name. The management is very simple. Usually there is no cure for Sjogren syndrome. We can only give artificial saliva and tears. So this was all about Sjogren syndrome. Let's do an example. So a 45-year-old female presents complaining of a sandy feeling under her eyes and difficulty in swallowing for the last year. So a female with sandy feelings in her eyes and difficulty in swallowing, and she also has bilateral parotid enlargement, you will suspect Sjogren syndrome. Investigation is Kimmer test, which will show decreased tear production, and Rose Bengal stain will show corneal ulceration. Anti-Rho and anti-La antibodies, they are specific for Sjogren syndrome, and rheumatoid factor can also be positive. It's positive in almost 100% of the cases. Management artificial.
Specific will be anti-Rho and anti-La antibody.
Yes. Yes.
Okay.
So patient with dry eye skimmer test show 8 mm. So the normal tear production is more than 15 mm. So if it's less than 15 mm, then I will say that it's a positive skimmer test. So involvement of exocrine glands, you will suspect Sjogren syndrome. And there is no cure for Sjogren syndrome. We can only manage the patient symptomatically, such as in the form of artificial tear, artificial saliva, and plenty of water. So far, we have discussed 3 autoimmune conditions: SLE, rheumatoid arthritis, and Sjogren syndrome. In SLE, any SLE was a multi-system disorder, and any system of the body can be involved in SLE. Hints for SLE, they include malar rash, oral ulcers, and joint pain. Rheumatoid arthritis is basically also an autoimmune condition, and it can also involve multi-systems, but it mainly involves the joints. and it causes subluxation or deformities of the joints if not treated. And Sjogren syndrome, the main involvement is exocrine glands, which will manifest as dry eyes and difficulty in swallowing, and bilateral parotid gland enlargement. Our next autoimmune condition is systemic sclerosis. Sclerosis means fibrosis. So sclerosis, in systemic sclerosis, there is an increased fibroblast activity. This increased fibroblast activity result in abnormal growth of connective tissues. Abnormal growth of connective tissue can occur in the skin, it can occur in the blood vessels, it can occur in other organs of the body such as lungs, kidney, etc. So, systemic sclerosis is basically abnormal growth of connective tissue in different parts of the body. Depending upon the organs or the area involved, systemic sclerosis is divided into two categories. One is limited sclerosis or limited scleroderma. Uh, a variant of limited scleroderma is Crest syndrome, and the second type is diffuse scleroderma. So, limited scleroderma, as its name indicates, it is limited to, uh, it involves limited areas of the body, such as it is limited to the face and distal limbs. So, predominantly, the patient will present to you with the thickness of the skin or thick skin of the face and distal limbs. The initial sign, the first sign of limited scleroderma is sometimes Raynaud's phenomena. The disease is a slow in onset and it's slow progression because it's a limited disease. So the onset and progression both is slow. It is associated with anti-centromere antibodies. So anti-centromere antibodies, it is specific for limited scleroderma. Crest syndrome is a subtype of limited scleroderma in which C is for calcinosis, R is for Raynaud's phenomena, E is for esophageal dysmotility, and S for sclerodactyly, and T for telangiectasia. So Crest syndrome is basically a subtype of limited scleroderma, which is associated with telangiectasia, calcinosis, esophageal dysmotility, and sclerodactyly. What is Raynaud's phenomena? Raynaud's phenomena is someone has ill digits of hands due to ischemia. Then these digits become cyanosed when they are exposed to cold due to deoxygenation of the hemoglobin. So the digits are first fail and then they become blue. And when the blood supply is restored again, then they become red. So this phenomena is known as Raynaud's phenomena. And Raynaud's phenomena is sometimes the initial presentation of limited scleroderma. A subtype of limited scleroderma is Crest syndrome. Crest syndrome is associated with calcinosis. Calcinosis means calcium deposit under the skin. Sclerodactyly means thickening of the skin of the digits. And telangiectasia means abnormally dilated blood vessels. And the person may present to you with small pink red spots on lips and fingers. Now, the second type of scleroderma or systemic sclerosis is diffuse scleroderma. Because it is diffuse, limited scleroderma involved only the skin of face and distal limbs, while a diffuse scleroderma it involves the skin of trunk and proximal limbs. Because it is diffused, so it will involve a larger area of the body. Limited scleroderma was slow in onset and the progression was also slow. Diffuse scleroderma has a rapid onset and fast progression. There was no organ involvement in limited scleroderma, while diffuse scleroderma can involve other organs of the body, such as lungs and kidneys. Involvement of lungs will result in interstitial lung disease and pulmonary hypertension. The most common cause of death in diffuse scleroderma is respiratory involvement. Kidneys can also be involved, which will result in renal disease. So, in a limited scleroderma, there is no involvement of other organs, only skin is involved. In diffuse scleroderma, along with the skin of trunk and proximal limb, other organs of the body, such as lungs and kidney, are also involved. Limited is slow in onset and in progression, and diffuse is fast in onset and in progression. Now, the fourth difference between these two is that SCL antibodies are SCL antibodies are specific for diffuse scleroderma. SCL antibodies are positive in diffuse scleroderma while they are inactive in limited scleroderma. ANA is positive in scleroderma. It was positive in rheumatoid arthritis. It was positive in SLE. So ANA is basically a generalized term, that is anti-nuclear antibody. And then these specific antibodies such as SCL antibodies and Rho and La antibodies, anti-centromere antibodies, they are antibodies against the specific component of the nucleus. So you can say that these different antibodies, they are examples of anti-nuclear antibodies. So the specific antibody for scleroderma is SCL antibodies that are positive in diffuse scleroderma. While in limited scleroderma, SCL antibodies are negative, but ANA is positive in both the cases.
So sorry, you just said about one another anti. Oh gosh,
Anti-centromere antibodies.
centromere. When is it positive?
Anti-centromere antibodies are positive in drug-induced lupus.
Oh, okay, all right.
Anti-Rho and anti-La for Sjogren syndrome, and anti-SCL antibodies, they are for scleroderma. SCL antibodies can be remembered in association to it to the name of the disease, that is scleroderma. The first three letters of the scleroderma are SCL. So SCL antibodies are for scleroderma. So let's do an example. A 44-year-old female has pallor of her hands, followed by bluish discoloration after exposure to cold. So a female has pallor of her hands, and then her hands developed into a bluish color after exposure to cold. This condition has been persistent for 3 years. So what is this condition? This is Raynaud phenomena. She also has symmetrical peripheral arthropathy. Now she develops small pink and red spots on her lips and fingertips. So Raynaud's phenomena is present. Involvement of joints is also present. So you can see that joints can be involved in any of the autoimmune conditions. She develops small pink and red spots on her lip and fingertips. So what are these small pink and red spots on her lips and fingertips? What are they called?
telangiectasia.
Yes, telangiectasia. So there is involvement of face and uh, distal limbs such as fingertips. So is it also there is a history of Raynaud's phenomena. So what is your diagnosis?
It's a limited
Yes,
scleroderma.
limited scleroderma. And the variant of limited scleroderma is you can say it's a crest syndrome,
Crest.
though calcinosis and other findings are not present, but still telangiectasia is a feature of crest syndrome. So a 46-year-old female has failure of her hands followed by Raynaud phenomena. So you can see that Raynaud phenomena may be the initial presentation of scleroderma. She also has shortness of breath on walking and dysphagia. So now what is your diagnosis?
It's diffuse scleroderma because of the
Yes.
chest lungs involvement.
Yes.
But in general, it is systemic sclerosis.
Yes. Sometimes they will give the options of both limited scleroderma and diffuse scleroderma. Sometimes they will only write systemic sclerosis. The treatment of scleroderma is pain relief through non-steroidal anti-inflammatory drugs, aging the skin itchiness and skin tightness through lotions and moisturizers, etc. Supportive management, general management, no specific management for scleroderma. So this was all about scleroderma. Any questions so far?